If your ultrasound report says low amniotic fluid, don't panic, but don't ignore it either. This condition is called oligohydramnios, and today I'll explain what it means and what to do. What is amniotic fluid? Amniotic fluid is the liquid that surrounds your baby in the womb. It helps with baby's movement and growth, lung development, protection from pressure and infection, and temperature control. Low levels of this fluid are called oligohydramnios. What is oligohydramnios? Oligohydramnios means less amniotic fluid than normal for that stage of pregnancy. Doctors diagnose it using ultrasound, like the AFI or single deepest pocket measurement. Your doctor interprets the results based on your gestational age. What causes low amniotic fluid? Common causes include dehydration, a leak in the water bag, placental insufficiency, high blood pressure or preeclampsia, post-term pregnancy, certain baby kidney or urinary issues, and some medications. What are the symptoms? Many women feel no symptoms, but possible signs include reduced baby movements, the uterus measuring small fluid leakage from the vagina, or a tight, uncomfortable abdomen. Seek urgent care if you notice reduced movements or fluid leakage. What are the risks? Depending on the timing and severity, risks may include cord compression, restricted baby growth, preterm birth, labor complications, and the need for an early delivery. Early diagnosis helps reduce these risks. How is IT treated? Treatment depends on the cause and how far along you are in your pregnancy. It may include increasing hydration, treating any infections or blood pressure issues, frequent monitoring, and in some cases, a planned early delivery if the baby is at risk. Always follow your doctor's personalized plan. Low amniotic fluid doesn't always mean danger, but it does mean closer monitoring to keep your baby safe. Follow for more pregnancy safety and high-risk pregnancy awareness.